Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. On today's program, we're going to dive into a very interesting report that crossed my desk called The Great Shakeup that found a lot of very interesting information about the potential churn we could be facing in certain technology categories in healthcare. That report was put together by the folks at Panda Health. And joining me today on the program is Ryan Bengtson, President and COO at Panda. Ryan, welcome to the program.
Thank you, Colin. Happy to be here.
I am very excited to get this chance to speak with you because I found the report fascinating. So congratulations on putting together some pretty amazing data.
Thank you. Yeah, our research marketing team did a great job on this one, so we're very proud of them.
So let me start with this first question then. Ryan, at a high level, can you give our audience a quick overview of this Great Shakeup Report?
Sure. Yeah, I think at this point, everybody is familiar with the impact that the pandemic had on the rapid adoption of digital health technologies. And what this report really sought to do was look at this phenomenon a few years later, now that most of the dust has settled, and look at the consequences and what we can predict coming up here in the near term as a result. How satisfied are health systems with the solutions they deployed? How many of those contracts are expiring in the near term, and what's the likelihood that they'll renew those contracts versus look for other solutions now that needs and situations have changed compared to where we were in the pandemic era. So we wanted to dig in and give our readers a sense of what we thought was on the horizon.
Now, one of the metrics or one of the factors that you considered in determining whether a category of technology, for example, like telemedicine or like remote patient monitoring, like these kinds of categories, you categorize them as high, medium, or low churn potential. And one of the factors was, how satisfied they were with their satisfaction level. One of the clarifying questions I wanted to ask was, did you find that it was dissatisfaction with the technology category as a whole, or was it just dissatisfaction with the one they chose to implement?
Yeah. The question itself didn't specify, but as we've kind of delved into the results and also spoken with a lot of our health systems, what we're primarily hearing is that it's really more around the deployment of a lot of those solutions. Again, they were rushed into deploying these rapidly to meet the needs of the market. They didn't have the time to do the probably appropriate level of process redesign, people change management, technical integration that are the cornerstones of a good deployment. So in most cases, we haven't heard that folks have lost confidence in the potential of the solutions to deliver on their value. There may be issues with, maybe they chose the wrong solution in a hurried fashion, and therefore are going to reconsider that here as those contracts expire. In other cases, it may be that they chose the right solution, didn't necessarily deploy it in the best manner, and now the opportunity is there to maybe go back and adjust some of those.
Yeah, I mean, one of the numbers that stood out for me, and it's good. First of all, it's great to hear you say that because my hope is that people don't lose faith in the technology, but maybe just aren't happy with the way they deployed it. But one of the numbers that jumped out at me, which led me to ask that question, was the telemedicine category, because that category you earmarked as a high potential of churn, and almost 1,600 plus hospitals could potentially change the solutions between now and 2024. That is a big number. And it, so to me, not too surprising in the sense of, I think we can all agree telehealth was one of the few solutions that were very, very quickly adopted, during COVID. But still, it is a bit surprising that this many hospitals aren't happy with the one they chose to implement.
Yeah, for sure. And I think what lies beneath that is a couple of things. One, you're right, that was probably the single most adopted technology that was directly a result of the pandemic, when patients and providers were unable to meet in person as they had in the past, and we needed some other alternative. I think one of the things you're seeing in that report, the reason that adoption rate and that number is so high, is that so many of our customers have also adopted multiple telehealth products. So we've seen many situations where within even a moderately sized health system, different facilities went with different telehealth products, different departments went with telehealth products, the provider practice went with something different than the inpatient areas. And so I think what you'll see is not just, as we refer to in the report, a lot of the rip and replace, but a lot of rationalization of, we now have 7 different products that were deployed out of necessity. Let's step back, really figure out what our use cases and requirements are today, and how do we rationalize that down, ideally to one platform that could meet all of our needs, but at least a more reasonable number. And so I think that's going to be a significant part of that churn, is really the rationalization of those solutions, especially in telehealth and RPM, as we highlighted in the report.
So other than the telehealth numbers, was there anything else in the report that you found surprising? Was there a result that jumps out at you?
Yeah, I think some of the low rate of adoption of some of the other solutions I found interesting. So digital patient intake, for example, relatively low price point, very clear ROI in terms of how that allows you to leverage your staff more broadly, especially in this current environment when it's so difficult to fully staff your facilities. And as you saw in the report, it's got a very high level of satisfaction. So the fact that product had only been deployed, I think, across 20% or so of our respondents, I thought was pretty interesting. The other thing that jumped out at me, which wasn't actually in our report, it was in some of the data that we gathered but didn't make kind of our final publication, is that there were a couple of categories around revenue cycle features like prior authorization and financial clearance tools, despite the fact that those were not largely deployed as a result of COVID. They've been around for a long time. And generally, have been used for so long. Very high level of dissatisfaction with those solutions even today. So I was surprised, as you mentioned, kind of the satisfaction rates, that there's some newer technologies that have high satisfaction that are not being adopted, and some I would consider legacy technologies that folks still really aren't embracing.
That is really interesting, and probably deserves its own article and its own study.
Right, we're reserving that for another future report. So I don't want to give all of it away right now, right?
Sounds good. One of the things that I inferred from some of your data, which it makes logical sense when you think about it, but I noticed that there was it seemed to be a correlation between high satisfaction of the product or of the categories that people had adopted and the renewal dates of the contracts, meaning the more satisfied someone was with the technologies, the renewal dates were further out in the future. So if you go and look at, for example, the self-service patient scheduling solutions, there was a very high satisfaction with those solutions. And it looked like, according to your report, the majority of the contracts are expiring in 2025 as opposed to 2023 and 2024.
Okay.
Which to me seems to indicate well, if you trust the solution and you're happy with it, of course you're going to sign a longer contract. Whereas if you're not as happy, or maybe you're a little bit more uncertain, you might opt for shorter term, right? So
that's true.
If you go through and look at look at the results, I noticed that correlation. It's not perfect, but it seemed to be, and that sort of reaffirmed my it reaffirmed the logic of, well, it makes total sense.
Yeah. I think in addition to the confidence in the solutions, it is also the degree to which the deployment is so tightly integrated into your environment, right? So certain things like the digital virtual assistants or AI chatbots that go on the website, those have a lower change out cost because of the implementation, whereas obviously patient self-scheduling, huge impact on provider schedules and patient flow and things of that nature. So a little bit more tightly integrated as well. But I think your point about kind of the level of confidence that they had at the time of deployment factors into that as well.
So let that sort of, we go take a step back and look at all the numbers that are in this report in terms of the potential churn that could be happening in the industry. What does the results suggest might then happen in healthcare over the next 6 to 12 months?
Yeah. I think, we talk a lot in the report about kind of the rip and replace. And as I mentioned earlier, with telemedicine being a great example, that's probably going to be more a factor of rationalization, in part because they deployed so many, competing solutions or similar solutions. I think the other thing that we're seeing in the industry is, all of these technologies are continuing to advance and expand. So in many cases, it doesn't even need to be the same category of product, but now what used to be just a CRM tool also does patient messaging or, other capabilities. And so a lot of these health systems, I think, are looking again to rationalize these solutions down, not even across the same, feature or functionality, but across these technologies that have broadened the footprint of their platform. So I think you'll see a lot of that. I think the other thing I would say is, the needs have continued to evolve as well. So the issues we were solving back in 2023, those needs have changed, the use cases have changed. And so I think there's a real question to be asked on some of these solutions as to, are they still meeting the needs of your patient population, your demographics, your current situation? And it may be that you deployed a solution that was fully necessary at the time, and maybe it's just a true rip and no replace. Maybe it's no longer necessary, and can be done in other ways, or just is no longer a required product. So I think you'll see a lot of that turnover and churn forthcoming, and I think it's going to require a lot of thoughtfulness and intelligence on the part of the health systems to really think through what does the next 3 to 5 years look like, and not just trying to address that near-term challenge that came about in 2020.
Yeah, I certainly hear you on the whole rationalization trend, if you will. We're certainly hearing it from the CIOs we speak to and from the organizations we speak to. There seems to be definitely an active initiative to reduce the number of vendors and reduce the number of systems that people have deployed. It just makes sense, right? If why have 50 when you can just we just need 5, right?
Yeah, exactly.
And as you said, not only is it an efficiency thing and just reducing the number of vendors, but also the vendors themselves are expanding into other areas. And so what used to be just a CRM, as you gave the example of, has now gotten into, patient self-scheduling solutions and maybe some patient communications. So now it's a lot easier to say, oh, well, I'll just go with that vendor because I need it for this other thing. And now they can do B and C as well. So this is great. And so given all of that, at the ground level, then, given what you know of the industry, given where Panda is positioned in the industry, and given the information you've gathered in this report, what does this mean for a vendor? If I'm a vendor listening to this and watching this, what should I do?
So I think there's a couple of key takeaways for the health IT companies. One, I think, recognize that being an incumbent may not be as much of an advantage as it once was. In most cases, there's a high degree of technical change costs, and that may still be the case. But given this flurry of activity that happened a few years ago, again, even if it's not rip and replace, it is rationalization. I think you may be deployed at several health systems, and your position may not be as comfortable as it once was. So I think if there's any concerns about customer satisfaction, I'd be getting on the service recovery process as soon as possible, or making sure that they're educated to the full breadth of your offerings, so that as they do start to think about rationalization, you're positioned in a better light. So I like I said, I think before it was, oh, we're already in there, it's going to be too expensive for us to make that change, but I think that reckoning is coming. The other one, which I've kind of alluded to, and I think is obvious, but just needing to continue focusing on the current needs of the health system, and all technology companies are continuing to evolve their products and make sure that they're meeting the needs of their customers. But the adjacencies that we're seeing in those products, again, CRM moving to patient messaging, moving to other capabilities, expanding that footprint and making sure that you're tying that to the needs of the market today, and what we predict will be coming in the next 3 to 5 years.
I really think that's sound advice.
Yeah,
I really do. Basically what I'm hearing is you can't rest on your laurels. And I think in the past, you might have been able to do that because it was so difficult to get into a healthcare system that once you were in, it was, you were in for a few years. What your report suggests is, for certain categories, that is not the case.
Yeah, at least this go round, right? I mean, I suspect that we'll revert back to that when organizations do have the luxury of time on their side, which they do now, to do more thorough vetting, maybe purchase longer contracts because they have a higher degree of confidence, and then that incumbent benefit will reemerge. But I think in this next couple of years, as our report suggests, that high rate of churn would suggest that the incumbency is threatened a little bit.
Well, Ryan, you've shared a lot of great information today. Thank you so much. Where can people go to get the report, and where can people go to find more information about Panda Health?
Yep. So Panda.Health is our website. You can find the report there, as well as access to a list of solutions and categories we're looking at, and all the other information you would want about Panda Health. So stop on by.
Amazing. Well, thank you so much for your time today, Ryan. And thank you again for all this great information you shared with me today.
No, thank you, Colin. Very much appreciate the time, and good luck to you.
Hey, if you enjoyed this interview as much as I did, why not check out more great videos and articles on healthcareittoday.com. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.